Hi everybody, Butch Stearns once again here at our HealthIT Summit 2012 with Keri Fraser, who is from Vocantas. Keri, first of all, thanks for being a part of sponsoring our event and help put this event on.
Our pleasure.
Yeah, now you're the director of marketing. Event like this, I've found it very interesting, insightful. This is your field of expertise, but I get the feeling that this has been a worthwhile event for you on a lot of levels.
Absolutely. At Vocantas, we really pride ourselves on collaborating with our partners and customers. So it's really key for us to be out speaking to people, talking to doctors and physicians who are really working in the trenches, and for us to understand what their pain points are so that our solutions can really answer a real need.
Talk about Vocantas just in general. I mean, you're in the voice recognition business, and when you think about health and that field, Nuance Communications is here. They're talking about things that they do. What do you guys specialize in? What do you like to say that you do best?
What we do best is really understand the human behavior side of the business. So our solution reaches out to patients and really understanding how they're going to respond to being interacted with an IVR. And so Nuance is actually a partner of ours, and their speech recognition solution is second to none in the industry. So really proud to be a partner with Nuance, but really key for us to understand how a patient is going to respond to being reached out to on behalf of the hospital and as part of their overall care plan. What's really important to the patient, ensuring that the patient is going to get something out of that phone call. And as you've heard us say here at the conference, we really like to look at it as it's a virtual hug. So you've had an experience, you've been in the hospital, and perhaps the system is reaching out to you for post-discharge follow-up to say, did you understand? Did you understand the medication? Are you staying compliant with your plan? And are you okay, or do we need to follow up with you?
Yeah, quite honestly, I thought you and Gary up on stage, the handful of times you were up over the last 2 days, were very insightful. You're very passionate about what you do. And for you personally, stealing from the patient end, I mean, you unfortunately have had a lot of experience from the patient end, as you mentioned up there on stage, but it gives you a perspective of what the end user is going through and who you're really trying to help here, doesn't it?
It sure does. And it we're all patients. All of us are a patient
one time
of healthcare.
Or another, right?
That's right. And so having some of that real world experience and understanding that, can technology really help healthcare with reducing some of the costs and reaching out to patients when we just can't afford to have 20 nurses making phone calls on a daily basis from one clinic. We need a solution that can reach out to patients, follow them up, and make sure that they're staying well at home, because we can't afford to have them back in the ER. So I am passionate about it because our solution works, and because we've really been able to help a lot of hospitals reduce their costs and improve their patient care. So
two final quick questions.
Sure.
One is about this event. So being at this event, you said that part of your DNA with Vocantas is to collaborate. And so what did you get out of this that maybe you didn't expect, or that reinforced something that you believe in with Vocantas?
Well, collaboration is key. We have to be out there talking to people so that we're staying on track with what's really important and getting the pulse of what's going on in healthcare.
Nice plug there. You're a real pro. We appreciate
Absolutely.
that.
Well, the Pulse Network helps us be able to do that and really stay in touch with what's going on. But I think what we really learned at this conference is that, it's the hype about hardware and having the most fabulous latest iPad in your doctor's hand. That's not really where it's at.
Right.
Really using IT to do what we need to do in healthcare, but more efficiently, more effectively. And whether it's in Canada or the US, we all have the same problem. We need to serve patients, but we can't afford to keep doing it the way we've been doing it. So Call Assure and the Vocantas solution is really a way to solve that problem. So we're pretty excited about that.
And final question, as the director of marketing, maybe for somebody out there that's in a similar position of yours, that's in the healthcare field or the financial field, a highly regulated industry, what have you learned from marketing Vocantas' products and services and solutions that you can give for advice for people that think our industry is so restrictive, there's only so many things that we can do?
Yeah, you still have to be out there. You still have to be talking to people, regardless of the regulatory environment. The issues are still the same, and you've got to find a way to get around those. I mean, some of the regulations that we face here with HIPAA and PIPEDA and privacy regulations, you have to collaborate with your customers to find out how you're going to solve that problem. You really need to be out there talking to people, and the Pulse really gives us an opportunity to do that.
Great.
So you got to be out there talking.
Thanks, Keri.
Thanks so much.
Yeah, you guys have been a great addition to our event. We're glad to have you.
Excellent. Thanks so
All right.
much.
Butch Stearns with Keri Fraser from Vocantas. This is part of our HealthIT 2012 coverage.